Molt bona tarda a tothom. Moltes gràcies per haver vingut, malgrat aquest dia plujós i de revolucions estudiantils. Tenim alguns representants. La conferència d'avui la presentarà el professor Josep Maria Terri Cabres. Jo només us vull introduir que el professor Thomas Pogge forma part del Consell Acadèmic Internacional de la Facultat de Medicina i ara estem a punt de començar i em toca dir una petita cosa de housekeeping, que és que aquesta conferència, a part de ser emesa en directe per internet, serà gravada i heu de ser conscients de que es gravarà. Moltes gràcies. Deixo pas als conferenciants.
Gràcies. Moltes gràcies. Bona tarda a tots. Dear Professor Pogge, thank you very much for coming, for being here with us. You have been here for the first time in April 2009. You came invited by the chair Further Mora and by the group of philosophers in this house to explain us a little bit your project. And now you come again, and that's really great, and we thank you very much. Voldria simplement presentar una mica per a aquells que no sàpiguen ben bé qui és Thomas Pogge. És professor de Filosofia i Relacions Internacionals a la Universitat de Yale. Va doctorar-se a la Universitat de Harvard amb una dissertació sobre John Rawls. Rawls és segurament el filòsof polític més més important del segle XX i un dels grans de la filosofia política en la història del pensament. Pogge és autor de molts llibres i articles en temes de filosofia política, especialment relacionats amb el cosmopolitisme, la justícia global i la pobresa. Ell justament és un dels que aconsegueix, diríem, de popularitzar el terme de global justice, del que es tracta, i aquesta és una habilitat que tenen pocs i que el professor Pogge té, i és que els principis una mica abstractes de John Rawls, ell diu bé, aquests principis abstractes potser que els concretéssim, potser que n'arribéssim a fer alguna cosa, i que per tant quan parlem de justícia global es notés i passés alguna cosa, i ell treballa en això. Té un llibre molt i molt cèlebre, en té molts, però un que se'n diu Poverty and Human Rights, Cosmopolitan Responsibilities and Reforms. La primera edició va ser de l'any 2002 i aleshores va ser traduïda al castellà per Paidós el 2006, però en canvi hi ha una segona edició que és ampliada i millorada del 2008 i aquesta no està traduïda, està traduïda la primera, però en canvi no la segona. Allò que fa que la contribució de Pogge al debat sobre justícia global sigui original és que elabora un argument punyent a favor del deure negatiu que tenen els rics, països i persones riques en el món, de no mantenir, no continuar alimentant l'actual ordre polític i econòmic internacional, ja que la pobresa del tercer món i la violació dels drets socioeconòmics de la gent del tercer món es deuen en bona part a aquest desordre. En filosofia política sovint es parla de deures positius i deures negatius. Els deures positius són aquells en els quals tu has de fer alguna cosa per l'altra i els deures negatius són aquells en què no fas o has de veure que no es faci des d'un punt de vista de justícia. Els rics tenen, doncs, segons ell i segons molts, l'obligació de contribuir a l'erradicació de la pobresa global, introduint reformes en les institucions d'abast global. En aquesta línia, allò que fa molt interessant la figura de Pogge és que, a banda dels arguments de caràcter filosòfic i moral, també pensa i promou, com deia abans, propostes concretes, propostes de reforma de les institucions globals i de l'ordre internacional. Actualment està promovent, i d'això ens parlarà avui, conjuntament amb l'economista Aidan Hollis, de la Universitat de Calgary, un fons per a l'impacte en la salut, és aquest Health Impact Fund. La idea és crear un fons, ara ens ho explicarà, que reculli aportacions dels diferents governs del món per tal de fomentar que les indústries farmacèutiques investiguin i elaborin medicaments i tractaments que puguin ajudar la gent que realment ho necessita, no aquells que simplement ho poden pagar. I això seria realment tan revolucionari, oi? Que aquesta és la dificultat que sempre se li posa a Pogge, és tan revolucionari que no podrà ser, oi? Però ell ja ens ho explicarà segurament. El projecte es troba en un estadi encara preparatori, encara incipient. El professor Pogge es dedica, entre altres coses, a passejar-se pel món explicant-lo, aquest projecte, i mirant de convèncer a tothom que pot, oi? De la bondat del projecte. Ja dic que fa 2 anys ja va ser aquí, oi? I va donant voltes pel món, diríem, i en aquests moments col·labora, treballa, és a dir, col·labora en el Consell Assessor de la nostra Facultat de Medicina, oi? De la Universitat de Girona, cosa que em sembla que és una gran cosa, perquè la nostra universitat, i concretament també Medicina, necessiten d'aquestes grans aportacions internacionals que s'homoguin una mica, que no siguin només tècnicament correctes, sinó que siguin també moralment atrevides. És per això que és un goig tenir el professor Pogge aquí, no sóc jo qui he d'explicar el que ell fa i vol fer, entre altres coses perquè jo potser ho explicaria molt malament. Thank you very much. I just introduced you a little bit, but I hope very much that you can explain us everything, and that after your talk perhaps we can put you some questions in case we have some to put to you. Thank you very much. Thank you.
Good. So, in one respect, I will not be able to explain it better than you because I don't speak Catalan, and so it will have to be in English, and I'm sorry for that. So I will give you that PowerPoint if you want to keep it and look at it later in your own leisure, and you will be able maybe then to look up one or another thing that was going by a little bit too quickly in the lecture. So I want to update you on this project, the Health Impact Fund project, explain a little bit what it is about, and also tell you where it is now, where it stands. So the current situation, as you know, is a situation of financial difficulty for many of the rich countries. In the wake of the global financial crisis, many rich countries had to tighten their belts and focus on their own problems domestically. So if you go today to governments in the rich countries, or any governments, and say, oh, let's do some new big global initiative, people say, forget about it. That is not a good idea. Come back in 5 years, and then we will think about it. So it's important, if we want to achieve anything today, to focus on reform projects that are win-win, that are not projects where the rich give to the poor or anybody gives to anybody else, but projects that make everybody better off. And the Health Impact Fund is a project that really makes everybody, or almost everybody, better off. And I will explain to you how that is the case in a moment. The Health Impact Fund is a structural reform, a reform in how we incentivize pharmaceutical innovation. And it's a reform that brings enormous benefits in terms of cost effectiveness and health impact achieved for money. And these benefits will primarily go to the poor, but they will definitely also go to wealthier populations. Now, to explain the Health Impact Fund, I have to first tell you a little bit about the status quo, about the situation as it is now. The situation now is characterized by the TRIPS agreement, which stands for Trade-Related Aspects of Intellectual Property Rights. That is an agreement that was concluded in the context of the new WTO treaty, World Trade Organization Treaty, in the mid-1990s. And that agreement basically commits all the WTO member states to a very high standard of intellectual property protection. That goes for trademarks, for patents, for copyrights. All of these things have to be protected very strongly, like the United States and other Western countries had protected them before. Before the TRIPS agreement came into effect, India, for example, which is the most important country for my topic, had lower levels of intellectual property protection. You could get a patent in India, but only a process patent. A process patent protects a way of making a medicine, but not the medicine itself. And so it was possible for Indian generic companies to invent around the patent. They would find a new way of making the same medicine, and they would then compete with each other to sell the medicine very cheaply to Indian patients and to African patients and to patients all over the world. Exactly this is what the big pharmaceutical companies of Western countries wanted to stop. They wanted to get a real monopoly. So they insisted that the Western governments should insist on product patents which protect the molecule itself, irrespective of how it is made. And these product patents became the law for all the WTO member states, even the poor countries, and on the 1st of January 2005. So since that time, even India has a product patent regime, and like all other WTO member states, it has to protect these patents for at least 20 years. 20 years from the time the patent application is filed, you have to protect the intellectual property. Yep. Now, there are various problems with this system. There are obviously also good sides, but I will focus on 9 problems with the system. The first one is that high prices make it difficult for poor people to afford the medicine. And we have to understand why the prices are high. Somebody who has a monopoly will price the product in such a way as to maximize their profit into the future. They don't care about the past cost. They care about the future profit. And prices are high for 2 reasons. One is that the rich patients will pay as much as they must pay to get the product. So if you have an important medicine and you raise the price, then those who can pay the higher price will pay the higher price. I want to survive, so if I have to pay 1,000 euros, I pay 1,000 euros. If I have to pay 2,000 euros, I pay 2,000 euros. So rich patients are willing to pay more, or their insurance companies or their governments are willing to pay more. The other factor is that there is very extreme global inequality. And you see that on this diagram here, which is the demand curve for pharmaceuticals. I'll quickly speak a bit louder and explain. The profit that a medicine company makes is the price minus the cost multiplied by the volume, how much you sell. And so you try to and when the rich are willing to pay very high prices, then it's optimal for pharmaceutical innovators to charge a very, very high price. So with medicines, as you probably know, prices can be 50, 60 times as high as the cost of production. It can be very cheap to make the medicine, but the markup is really very large. Here is the distribution of income in the world. You can see here that the top 5%, which is us basically, we have about 9 times the global average income. The bottom half of the human population altogether have only 3% of global income, and the bottom quarter has only a little more than 0.75% of global income. So the difference between the people in the top 5% and the people in the bottom quarter is about 300 to 1. It's a huge difference. And of course, pharmaceutical companies, like all companies, they act in order to make money. They are profit-maximizing companies, and so they go after us and not after the patients in the bottom half. They're not very profitable targets of pharmaceutical research and pharmaceutical